Mesothelioma. Etiology. Asbestos fiber has been used extensively for its fire-resistant properties in the building industry, in shipbuilding, and for brake and clutch liners in cars. It was mined in countries as far apart as the former USSR, Canada, and South Africa, and transported to countries such as the UK by boat. The crocidolite form of asbestos is now known to be particularly hazardous in causing the associated lung diseases. Asbestos fibers are inhaled and become lodged in the alveoli where they are incompletely phagocytosed by macrophages. The resulting inflammatory reaction leads to local tissue damage and fibrosis, and is thought to increase susceptibility to malignant change. Epidemiology. The effects of asbestos tend to occur 20 to 40 years after initial exposure. Therefore, as asbestos controls only became law in the late 1970s, it is predicted that we will continue seeing cases well into the 21st century. Clinical presentation. Shortness of breath. Weight loss. Chest wall pain. Physical signs. Evidence of a pleural effusion and / or pleural thickening with decreased expansion on the affected side. Decreased breath sounds on the affected side. Decreased breath sounds on the affected side. A careful occupational history is required from anyone presenting in this way. Investigations. Despite vigorous investigation, it is sometimes not possible to obtain diagnostic histology confirming mesothelioma in life. Special stains can help, and it may be worth discussing this with the pathologist. Pleural biopsy and aspiration. Thoracoscopy and biopsy. CT scan of the chest, Fig 32. Lung cancer. There is a symbiotic relationship between asbestos and smoking, with lung cancer being 5 times more common in smokers exposed to asbestos than smokers who have no exposure. Sarcoma. Benign pleural thickening. Treatment. Emergency. Drain the associated pleural effusions if the patient is very short of breath. Only consider pleurodesis once you have a tissue diagnosis. Short-term. Radical surgery, involving rib and lung resection, is attempted in a very few patients with limited disease. Pain can be a major problem and difficult to control, even with opiates. Involve the experts, i.e. the palliative care, Macmillan, team early. Local radiotherapy, deep X-ray therapy, may sometimes help. Cervical cordotomy can help intractable unilateral pain. Surgical or medical pleurodesis can help prevent recurrent pleural effusions. Drain sites should be irradiated to prevent recurrence. Mesothelioma is notorious for seeding along tracts. Long-term. As usual for diseases where the prognosis is poor and treatments ineffective, various trials are underway testing different treatment strategies. These include comparative chemotherapy trials, as well as a trial of tumor debulking plus chemotherapy versus chemotherapy alone. Complications. Repeated pleural effusions. Severe pain. Prognosis. Poor, with limited response to therapy. Median survival is 12 to 18 months. Prevention. There will continue to be a rise in the number of cases until at least 2015, as the rules controlling the use and handling of asbestos were only enforced in the late 1970s. The 20 to 40-year latency from exposure to symptoms means that patients who were youngsters then will continue to present for some time. NB. Compensation claims. Patients with mesothelioma, asbestosis, diffuse pleural thickening and lung cancer associated with asbestosis are entitled to state compensation and receive a disability pension. Patients may also be able to make a claim against previous employers for any asbestos-related condition, including pleural plagues, and may receive compensation if the employers have been negligent in exposing them to asbestos. If patients wish to pursue this course of action, the law generally allows them only 3 years in which to commence legal action after the date on which they first knew they had an asbestos-related condition. It is good practice to record that you advised the patient of this point when you diagnose an asbestos-related condition. Similar procedures for both state benefits and claims against employers may be followed for coal workers' pneumoconiosis, occupational asthma, and a small number of other industrial lung diseases. Disease associations. Non-pleural mesotheliomas may occur as a primary disease on the pericardium, usually presenting as constrictive pericarditis. Diagnosis is normally made by pericardial biopsy. Peritoneal mesothelioma causes vague symptoms of tiredness, lethargy, and loss of appetite, followed by abdominal distension caused by ascites. Diagnosis may be made by laparoscopic omental biopsy.